The idea of the early dialogue is basically meant to give a joint advice mostly to those more inexperienced producers like SME, spin-off, academia, who, and is meant to address basically the high attrition rate in the early phase. Our fear is that we have a lot of very good products that fail because of, let's call, regulatory ignorance. And that exposes patients and then it causes a lot of inefficiency in the system.
The patients' organizations are growing in numbers. I don't think it's because of stimulus of industry, which many countries, many critics will say. I think the way citizens see the role as a patients and the advocacy rate is simply growing. I mean, people, they don't accepting the situation as maybe they accepted years ago, that this doctor's problem is a hospital problem. Many society people said, it's my problem, and I would like to contribute to solve my problems.
I think an innovative medicine today has to address an unmet medical need and has to provide an added value. And when we talk about added value, unfortunately, we have to bring in the price, the cost. The added value comes at a cost. And even if EMA is not meant to intervene in any economic consideration in any of these aspects, still we have and we should have the concern about assessing the medicine that nobody can afford. So with this concern in mind, we are exploring together with the Commission, with many other stakeholders, what could be our contribution, what can we do.
And just two final points before I'll stop. The systems component of what we've been talking about, and we mentioned this already, the accountability component of the systems component, the incentives within our system for some of the issues that we're dealing with, the competences, the communications element of what we're talking about. Innovation we've already mentioned to a certain extent, but again, we're talking about innovation in different areas of the system. And in addressing what we're really looking at in terms of change, we of course cannot forget the leadership and the management components of both. And I think I'll stop there.
Excellent. Thank you very much indeed, Monika. That's great.